Hi, welcome to Represent NYC. I'm Victoria Bird. I'm the producer of this show. And today we're going to bring you another virtual conversation with one of our city's representatives. Because of the coronavirus pandemic, we are all working from home, doing the best that we can, but we wanted to bring you today City Council Member Mark Levine, who represents the 7th District, Northern Manhattan here in New York City. Hi, Mark, how are you?
Hi, Victoria. I am doing well. I am staying safe at home, and I see you are too.
You did tweet out the New York City Health Report and how this COVID-19 is hitting certain racial communities. It's 22% Latin, Hispanic and Latin, 19.8% Black, and then I think it's like 10% white and 8% Asian American. And what do you think that says, if anything? I mean, a virus is not gonna, it doesn't choose, but what do you think that says?
Well, it says a lot. It's painful. We have to confront it. And that's why we have been agitating for a long time for the city to publish this data. It's really important that they have now done that. They have published breakdown of deaths from coronavirus by race. And I think it confirms what a lot of us were suspecting and experiencing when you look at the neighborhoods that have been hit hardest in New York City, the hospitals in those neighborhoods that are overflowing, and the anecdotal evidence. The very painful truth is that this pandemic is exacerbating existing inequalities in New York City and reflecting those inequalities in housing, inequalities in employment, and most of all, inequalities in healthcare, racism in medical institutions, unequal access to healthy food. And all of that has contributed to unequal health outcomes in New York City for years, for decades, in rates of diabetes and heart disease and stroke and hypertension. All of that makes a person more vulnerable to contract COVID-19. And if they do contract it, it makes them more likely to get a very serious case that could lead to fatality. And we've been agitating for days, for New York City, weeks, to publish this. And it reflects a true injustice in the city that it's high time we confront.
And it's interesting because it's not even probably all the information, because if there are 10 people and 5 aren't reporting, this information is not even the full numbers.
This is not the complete picture yet. We urged the city to start publishing while we were building the complete picture because we didn't want to wait another week or month or longer. So I think they were right to put it out there, and they were clear about the limitations of this data. But what we already see paints a stark picture of inequality, and we need more information.
And also, I think you actually mentioned to me earlier when we were talking offline that it reflects how African Americans and Hispanics might be the ones that are staying on the front lines in the hospitals, at the pharmacies, at the grocery stores.
Look, the ability to shelter at home and to telecommute is a luxury. It's not a luxury everybody in this city has. The people on the front line in essential sectors are disproportionately people of color. And these are the people who are in healthcare, in mass transit, in supermarkets, pharmacies, first responders like EMS workers, and people in laundromats. They are putting themselves at risk for us to keep the essential functions of the city running. And tragically, it's part of the reason why New Yorkers of color are now confronting this pandemic at disproportionately high levels.